Hi everyone, it's Dr. Ranganai. We are going to talk about COVID-19 in pregnancy. So the first question that a pregnant mother is concerned about is, if I'm pregnant, if I'm at greater risk of getting this COVID virus, or am I at a greater risk of dying from this disease? For the first question, I would say that pregnant women, like the general population, are at a risk of getting COVID-19. However, there haven't been any studies to suggest that they are at a greater risk of getting this disease. In terms of dying from the illness, yes, it is known that if a pregnant person gets a disease that affects the chest because of the disturbance in breathing that occur because of the enlarging uterus, they may be at a greater chance of dying. However, there haven't been evidence to suggest that if they get COVID-19, they will be at a greater risk of dying. However, if you happen to test positive and you experience severe symptoms such as shortness of breath or chest pains, feel free to contact one of the emergency COVID numbers. The second question is, will I be able to transfer the virus to the child if I get infected while it's pregnant? There's good news for us. Recent evidence so far is not showing that this virus can be transmitted through the placenta, which is the organ that connects you and your baby. However, if you get infected, there also isn't much evidence to suggest that your baby will be protected when they are born. But we know that certain types of antibodies, if they are produced in your body, they may be transferred to protect your baby against infectious diseases and other diseases that you have been exposed to. For example, we vaccinate you against tetanus, and the antibodies that you generate also protect the baby for a period of time. Let's say we have COVID-19 and I'm pregnant. Am I still entitled to routine care in pregnancy? The answer is yes. Even normal delivery. A person with COVID-19 is still entitled to the routine care that is offered to in normal pregnant women, such as pain management and routine delivery. After delivery, and I'm still positive, do I need to breastfeed my child? Yes. Even close contact is recommended in patients that are COVID-19 positive. The good news is that babies are at little risk of developing severe disease. So take care of yourself, take care of your baby.
Hi everyone, I'm Dr. Rogers Shoshore Makiko. Amidst this COVID-19 pandemic that has gripped the whole world, most of us, if not all of us, have a grand question. Is there hope in this storm? Well, I am here to answer that question. Let's jump on to the statistics. You may be interested to know that as of today, the 14th of April 2020, about 1.9 million people worldwide have tested positive for COVID-19. And sadly, we have lost over 120,000 people around the world. However, it's also interesting to note that there is a silver shade on this. About triple these numbers have actually fully recovered from COVID-19. Actually, it is well known that of all the people that get infected with COVID-19, 80% of people do not need any form of hospitalization or clinic care, and they fully recover at home. 15%, however, would want hospitalization, and 5% would require critical hospital care, including intensive care unit. However, further on, as I've mentioned, we have had more than 450,000 people recovering world over. And in this group is an interesting subset. We will note that people over 100 years of age have actually also recovered, some from critical states. So there is hope after all in COVID-19. Kule themba kune tariro. What do we need to do? Let's social distance. Let's practice safe hygiene. Let's stay home. Kule themba kune tariro. Thank you.
Hi everyone, my name is Michael Yusuf Mamwadi and I'm a professional in the field of psychology. Today we are going to be discussing upon mental health and the COVID-19 pandemic. As we all know, this pandemic has caused a lot of trauma, heart stress, and many problems in people's lives. So we are here to help one another to find ways of how we can cope with this COVID-19 pandemic in our mental spheres. You realize that people are undergoing a lot of stress, loneliness, and gender-based violence cases are on the increase because of this pandemic. And as such, we need to find coping mechanisms, methods that will help us to be mentally sound during this time. Things that we can do in our homes are simple as exercising, doing some gardening, and also being engaged in the fight against COVID-19. How can I be engaged? Make sure that you stay at home, make sure that you practice social distancing, and that all the requirements and regulations that have been put in place by the government, make sure that you listen to them. Above all, in this trying time, trust in God. Take time to pray, take time to have faith so that you may not be stressed such that at the end of it all, your functioning has become impaired. He says, call upon me in the day of trouble, and I will deliver you, and you will glorify me. Stay safe, hlala uzigcinile ngendlela eyiyo. May God bless you and be safe.
Hi everyone, I am Dr. Tamsanga Lubimpingupi. With COVID-19, we are all equally responsible. How you and I behave determines the health and well-being of millions of people around the globe. By practicing these simple measures, washing our hands with soap and water, avoiding touching our eyes, nose and mouth, and avoiding going to the shops unnecessarily. If ever we go to the shops, by practicing a social distance of 1 meter or more, and by calling the toll-free number 201, which is on the screen, if ever we experience these symptoms of cough, fever, and shortness of breath, we can save our mothers, our fathers, our daughters, and our sons, and our friends, and our neighbors. And we will also reduce the spread of COVID-19. Thank you.